We're now, guys, to another plastinated model, but this time for female. And here again, let me show you the orientation of this model. Here's anterior symphysis pubis, this is a pubic bone, and here is the sacral canal and sacrum, of course, here. And here is the true pelvis. And well, guys, you can appreciate the existence of the urethra, vagina, and the rectum. And look, here is the obturator and internus muscle, and here is the tendinous arch of levator ani, from which you would appreciate the puborectalis muscle, pubococcygeus, iliococcygeus, where they inserted again, as I mentioned, in the male pelvis, in the anococcygeal ligament, or Refa't. Look at this arch. This is the tendinous arch of the pelvis, and these fibers of tendons, they are the anterior sacrococcygeal ligament. Here is, guys, the coccygeus muscle. So the levator ani and coccygeus, they form again, as I mentioned earlier, they form the pelvic diaphragm. Look at the sacral plexus here. Let me show you. This is the sacral plexus, and here's the lumbosacral trunk, and this is the S1, S2, S3, S4, and here, guys, the median sacral artery, which is a branch from the abdominal aorta before its bifurcation at L4, and these are two lateral sacral arteries. They are a branch of posterior division of internal iliac artery. Again, look at the sacral. Let me show you here. Look at the sacral plexus here. They are rest on the piriformis muscle. So this is the piriformis muscle. The piriformis muscle forms the bed of the sacral plexus, right? We talked about that earlier, guys. So above the piriformis, you have structures passed superior to it, like the superior gluteal artery, this one, right? Superior gluteal artery and superior gluteal nerve and vein, of course, while the structures below the piriformis leaves the greater sciatic foramen through the, or the pelvis through greater sciatic foramen, will be called here the inferior gluteal artery, vein, and nerve. Here, guys, you see the vulva, the external genitalia of the female, with the labia majora and labia minora, and between them you have the pudendal fossa. However, the labia minora, they unite superiorly to create like a tent called the prepuce of clitoris. Here is inside there you have the clitoris, and here is the vestibule of the vagina. Again, we have to move to the perineal area now, and you know that the external genitalia anchored to the perineal membrane. That means they are located in the superficial perineal pouch. Here's, guys, posteriorly again. Here's the, let me zoom out. Okay, here's the sacrum and coccyx. Here's the anus, right? This anal triangle with the ischioanal fossa, with the structures passed there, including the pudendal nerve and internal pudendal artery. You see here. Let's move anteriorly. We'll talk about the branch there, but let me show you first. Here's the from here and anteriorly, you have, guys, the urogenital triangle, and from here and back you have the anal triangle, in which the anal canal there, right? However, this is the superficially transverse perineal muscle. Deep to it you have the deep transverse perineal muscle. That means here's the superficial perineal pouch, to which these vulva and muscles attached to. I can define here. Let me flip it back again here, and here's again. Here is anteriorly symphysis pubis, right? And here is the labia majora minora. Look at the vestibule. Here's the vestibule to vagina. So here, guys, you have the bulb of vestibule, and the bulb of vestibule covered by a muscle. You see this muscle? This is called bulbospongiosus muscle. Bulbospongiosus muscle. And if you dig deep here, I don't know if we can see it. No, it's the phone. Okay, I think here. You know, this is the body of a clitoris, and the body of a clitoris, you know, formed by two crura, right? The right crus and left crus that extended here to form the corpus cavernosum. Both are corpora cavernosa, and both are covered by muscle. You see this muscle that covered the corpus cavernosum here, and here is our ischio. We call it ischio cavernosus muscle. Ischio cavernosus muscle on each side, but he's removed. You can see the corpus cavernosum, and here with the muscle. The muscle, we call it ischio cavernosus muscle. Okay, back again here to the gluteal region in the back. You can see the sacro-tuberous ligament, in which here is the greater sciatic foramen, and here is the lesser sciatic foramen. And the greater sciatic foramen passes a couple of structures pass from there, although it's not our topic today, but anyway, I can show you the piriformis muscle that divides the greater sciatic foramen itself, in which the structures pass superior to it. You can define the superior gluteal nerve and superior gluteal artery and vein, right? While inferior to it, you have the inferior gluteal artery and vein, and inferior gluteal nerve, right? And you have the sciatic nerve, and you have the posterior cutaneous nerve of thigh that gives a branch to the perineal area called the perineal branch. You see, the perineal branch of the posterior cutaneous nerve of thigh. Here's also, most importantly, the internal pudendal artery and pudendal nerve. Look at the pudendal nerve. It divides like early, close to the pudendal canal, and here, guys, the pudendal nerve gives like inferior rectal nerve to the anus and sphincter around the anus, and here the perineal branch, the superficial and the deep ones, in which they carry sensation from and innervate the muscle there in the perineal area. And here, guys, the deepest one, here is the deepest one, which is again, it's a branch of the, let me zoom in. Here's again, as I mentioned, this is the pudendal, gives inferior rectal, gives perineal branch, and here a deep one that passes to the clitoris called the dorsal nerve of clitoris, clitoris. I think this is what we can define it in this, we can see in this model.